What's up, everybody? I'm here with Dr. Raj, and we're going to go straight into a viewer question that just came in a little bit earlier. Sarah Grant asks, why does it seem like more celebs have COVID-19 per capita? Do they have more access to tests than regular people? I know there's a shortage of tests right now. What is going on with the tests? How can we really, keep the numbers right if we don't have everybody testing? What's going on with that?
I think testing has come a long way. When we talk about the big question beyond that is, well, how do we know that, if I had COVID-19, how am I cured? How do I know it's really going to be gone? And the big thing right now is going to be, are we basing that upon symptoms? Are we basing upon tests? And once again, Cassandra, I know you heard me say this before many times, is that my answers will change. You know what I mean? It'll change tomorrow and the next day. And I really have a couple of good feelings. Number one, the fact that people are already concerned about, am I cured? That means that we're kind of moving in the right direction. Before it was kind of like, am I going to die? Am I getting admitted to the ICU? So I've been getting personally a lot of questions now. How do I know if I'm cured? How do I know if I can get back out there? So the answer is a lot of it is going to be symptoms. You know why? Because symptoms are the reality. And when we talk about testing, there is going to be a rapid point of care test. And that is just amazing. So, I remember when we first started doing these videos together, Cassandra, when my patients were getting tested, it would take them almost 7 days to get the result. And people will be rolling their eyes and how can you isolate anyone? What does this mean? And during our time together, it went from 7 days down to probably 1 day, And now we're talking about a rapid test. So for example, for those who don't know what a rapid test is, it's going to be done in a healthcare facility. But, I have a 5-month-old and, about a couple of months or so ago, she had a cold. They went to her pediatrician. They did a rapid RSV, respiratory syncytial virus. They just swabbed and boom, I waited 15 minutes later. There's the answer. And that's what we're doing now. That's what we're getting now. And certain companies have been granted to make these tests. And I even, before even doing this interview, I heard that, companies like Walgreens are going to have drive-throughs so you can get some of these rapid tests. So, the answer is that it's changing, and that availability of tests. And that's why, your viewer who gave this question, it changes everything when we talk about, the world in our country. It depends where you are. Not everyone has equal access to tests. Even within the same state, even within the same hospital, it really depends, So hopefully testing has been moving in the right direction. It is more rapid, more people have availability, and that really is going to be changing and influencing some of the guidelines about how we determine are you cured or not, but still symptoms play a big part of this.
Yeah, because it does. I was looking at some updated websites on. I could just say like right now, 25 celebrities have it, 6 have died from it, and then in the United States, I just checked that there's just about under 15,000 that have actually died from COVID-19. So, if we can't get access to tests and we have indicators like fevers and things like that. When we do, when that kind of dies down, how should people wait until the test confirms, and like going back to school and things like that? Are we looking at the end of the month? Like, what does that look like?
So when we talk about the resolution of symptoms, let's talk about those first. I think that the main symptoms that we classically think about are going to be fever, it's going to be a cough, and it's going to be shortness of breath. And if you were to ask me of those 3, probably what is going to be the best indicator? Well, I would say the best indicator is going to be the fevers. And you're going to ask why. And it's, fevers are non-specific. I'll say that right away. Many things can give you a fever, but the fever is going to be objective, meaning that you have objective data. So when you have a fever, you measure it. And it's very easy to measure. It's objective. Here it is. You have a fever or you don't. The subjective finding that it's going to be the shortness of breath, meaning that, with shortness of breath for a young individual couldn't be the same as an older individual. For someone who has chronic lung disease, it's going to be different. So it's going to be very subjective when we talk about that. So we're not going to be using shortness of breath. And of course, we're not going to be getting serial chest x-rays to prove things or breathing tests to prove things. So saying shortness of breath is going to be subjective, objective is going to be the fevers. When we talk about cough in itself, the reason why cough isn't a good indicator for resolution is the fact that, when you have an infection, whether it's virus or bacteria, the cough just lingers forever. How many times have you had like an infection? Next thing you know, the cough lasts for a couple of weeks. So we're not going to use cough in that sense. So I would say it's what we have, but yes, I think that fever is going to be, one of the markers that we have, a good marker, a practical marker when we talk about resolution of symptoms.
Yeah, so we do know that Chris Cuomo of CNN has tested positive for COVID-19, and he gave some, some of his symptoms, and he's been very open about talking about this, and he actually said something about, fever and rigors. What are rigors? What is that?
Rigors, one of the two, is that when we talk about fevers, and when you get a fever, what really happens is that part of your brain called the hypothalamus is going to set your body to a higher set point. And when you have a higher set point, a normal, temperature, maybe me and you could be somewhere like 98 or so degrees Fahrenheit, but it'll set to a higher set point. Maybe it's going to be 102, 103, 104. So what your body does, it actually wants to generate heat to actually raise your body temperature to that set point. So what are things that your body can do to, generate heat is that it could have shivering, and very intense shivering is what we call having these rigors. And they can be very uncomfortable, but it's generating heat because you have a what? You have a fever. And then you could imagine that eventually when the fever goes away is that your body will actually be set at a lower normal set point again. So now your body needs to release the heat. And how does it do that is things like sweating, So when you're having the rigors, it is non-specific for COVID. You could have rigors from a bad viral infection, from a bacterial infection, and it's really going to be that reflexive response because you're wanting to raise that body temperature to that new set point. And I remember that, rigors can be very, very uncomfortable. And I think he actually chipped a tooth when he actually had such intense rigors over there. But the answer is that, for most cases, there really isn't a magical treatment when we talk about these rigors. It's staying well hydrated, getting good rest, getting good sleep. Of course, if it persists, you're definitely going to have to go see a doctor.
Yeah, it seems like there's a lot of controversy around these tests and, who's getting access to them. How can we really keep the numbers clear on who has this when, there was a report about some test kits found in the UK to be contaminated with COVID-19. I'm going to send that article to you. But I mean, there's a lot of confusion right now. So we're hearing something about home testing kits. What do you know about home testing kits?
Oh, that was the easiest question. There are no home testing kits. So, we are not home testing, for COVID-19 at this time. I would be very careful if someone even mentions that. It even scares me. And we don't even know what to do with this information, So when we talk about getting tested, it's going to be at a healthcare facility. We do have rapid tests. Like I mentioned, point of care rapid tests are done at a healthcare facility itself, which is very exciting. And the problem with a home test kit in theory, because there are none, is that, Cassandra, have you seen how we test for COVID-19 by any chance?
Isn't it like a long, pointing thing?
Yeah, it's called a nasal pharyngeal swab, and you will ram it up your nose. And I don't know if you see them on YouTube, it's very uncomfortable. I just don't see people at home ramming this Q-tip up their nose to get that swab. And the question is, if it's negative, was it a sampling error? Did you actually put it all the way up there? There's so many things that will raise questions. And if we did have a home testing kit, I think of it like a home pregnancy test. Just because you have a home pregnancy test that says it's positive, are you going to say, okay, that's it, I'm pregnant? What are you going to do? You're going to go see a doctor. They're going to confirm it with another test. So if they ever have home testing, it's going to be something where it's going to be kind of like a screening test, and you're going to have to confirm it anyways. But the answer is no. There's no home testing kits out there.
And do you think the state of mind, the way that you keep your body healthy and, your immune system and the way that you're thinking, the way that you're, are you exercising? Do these things also play a role in your ability to stay healthy in the midst of having all of this? If you do test positive?
And the answer is going to be yes, is going to be that whether you test positive or don't test positive, we need our immune system to be on its A game. And I think that this is nothing new I'm going to be telling you, is that if possible, try to exercise. Easier said than done. This whole social isolation and quarantining has changed the way we do our routines. There are no more routines. There's no more coming out with my buddy and riding a bike or jogging. Not all of us have a gym in our house. You know what I mean? When you see all these movie stars showing what they're doing on their gyms, I'm like, that's not my patients. They don't have these gyms over there. But you're right. You want to exercise. You want to eat well. You know what I mean? And I got to tell you, I don't know about you, Cassandra. Are you gaining weight during this time? I am. Are you eating all the time?
And drinking wine, and yeah, it was my birthday yesterday, so I had a happy hour online.
And my wife and I, we use the word grazing. All we do is graze when we're at home. We have like some cupcakes or cookies because everyone's baking because it's comfort food.
Yeah, it is.
And so you got to be careful. You know what
yeah,
I mean?
like I've made more dinners like full of carbs than like ever before in my life, and everybody's loving it.
And then sleep is a huge issue, and people say I could sleep when I drink my bottle of wine, and then like you said, so all these definitely play a huge role into that. So that's a great question. You definitely want to keep your immune system.
And I was traveling. I was directing something in New York last in February, and I came down with the symptoms that is COVID-19, and I just thought it was the regular flu, but I was traveling, I was flying, and I got over it, but if somebody like me knows that they had something, and if I did, will I just like let it pass? How would I know if I didn't get a test? You know what I mean? Like, how could we really track these numbers?
Yeah, no, this is one of the best questions you've asked, and so how do you know you're cured? And there's two ways to know that you're going to be cured. The first way is through testing. So what is going to be the standard testing to know you're cured? You need to have 2 negative tests 24 hours apart. And I would just spread that around social media, Cassandra. Everyone should know that 2 tests 24 hours apart. But what's the caveat? Testing is not as available. You know what I mean? And yes, the test, you can do one and you wait 1 day for the result. But when we get maybe that rapid test, that point of care test, maybe that could be more practical. But then once again, everyone's different in different geographies. Are we all going to have access to it? But what is the gold standard in a perfect world? 2 nasal pharyngeal swabs 24 hours apart. But like you were asking earlier, but many of us are using the symptoms. So there are very specific symptoms. And what it is going to be, you have to wait 14 days after the positive test. And you have to be 72 hours symptoms free. So I think you should also blast it out on your social media. So the question becomes, which one should you use? And the answer becomes, you have to take it individually. So let's just take me and you. You know what I mean? I think that, I'll talk about myself. I want to actually have the rapid test. I want to be proven through a negative test, not because I'm selfish about myself. It's my patients. I'm a pulmonologist. I'm going in the hospital and intubating patients. I'm right in your face. I'm breathing on you. I'm infecting sick people. So if I had it, I think that you have to say, who are you? What is your profession? Who are you exposing to? Are you working in a nursing home? Versus someone who's going to be at home and not going to be exposed. Maybe those would be the individuals to be the symptoms criteria versus who needs to have the testing criteria. But there isn't an answer for everyone. It needs to be taken individually. And the best answer is, at the bottom line point, is ask your doctor. You know what I mean?
Yeah, I mean, I think if we truly are on a shortage of tests, I would rather someone like you have access to the test than someone like me, who I feel like I already had it. It's gone. I'm not contagious anymore because it was so long ago. I don't really know that to be fact, but I wouldn't go out of my way as an individual to go get tested. I just wouldn't,
And here's where the controversy becomes, in New York, you know what I mean? They are suffering, and they have limited doctors and nurses and respiratory therapists. So many healthcare professionals have been exposed, and now they're getting cured. And we're sending them back into the hospital, you know what I mean? And the mentality is, well, you already got it, and you're really just gonna be exposed to it again. What's the point? You know what I mean? So it's scary, but then again, you know what I mean? It's hard to say what the right answer is going to be. You know what I mean? So there are so many decisions that have to be taken case by case, hospital by hospital.
Here's another question that we got. Should I get the pneumonia vaccine to prevent getting COVID-19?
You know, I think our healthcare TV network fans, they have good questions, you know, I like this one quite a bit. And I have heard this one before. And so the answer is that there's this rumor out there that if you get the pneumonia vaccine, and pneumonia vaccine is for strep pneumo. It's not for the walking pneumonia or any other pneumonia. It's for strep pneumo, which is the most common cause of community-acquired pneumonia. And the answer is no, that because you got the pneumonia shot, it won't prevent you from getting COVID-19. But the take-home message is that you should get the shot regardless if it's your time to get the shot. So when we talk about, you know, strep pneumo, people who are going to be around 60 to 65 years of age should get a booster, if depending on what shot they get. There are two main pneumonia shots out there, the Pneumovax and the Prevnar, and they could look things up, ask their primary care physician. We can make a video about it. But you need your vaccines. And I just want to say a little something I'm very passionate about right now is something called Bordetella pertussis. And everyone's like, what did you just say? That's the whooping cough. And whooping cough is actually something that we see more in kids, but it's making this horrendous comeback. It's easily transmitted through respiratory droplet, and it really is detrimental in people who have pre-existing lung disease and the elderly. So people who have not got or not up to date with their vaccines, and something like a Bordetella whooping cough should get it. Strep pneumo, get it. If you have pre-existing lung disease, you should get it. Get your influenza virus shot. So I'm a very big proponent of being up to date with vaccines, but none of those vaccines will help you with COVID-19.
Okay, that's good to know.
Yeah.
There's a lot of controvery around vaccines too. I would love to get some more insight on that as well. So, vaccines right now is an interesting thing because I personally, I want to know what's inside these vaccines. What are they putting inside? I want to know all the ingredients. I don't know about you at home. I just feel like we should be able to see that, right? Because what happens with a vaccine, they probably go and they put the ingredients in there, and then they probably have some type of way of making it intellectual property. So maybe they can't share all those ingredients, or can they? Can we actually look that up?
And I think that's a great topic for a different time. I would say my answers are always going to be the medical answer. I think the one thing that's going to be the take-home message for the people watching today is you need to know, is it a live or an inactivated vaccine? That's going to make a big clinical difference. And why is because a live vaccine, if you have pre-existing disease or you're immunocompromised, it could be bad. You know what I mean? So you want to know, I definitely inquire about these vaccines, and of course, allergies. You know what I mean? You have to know about your allergies. And once again, I do agree with you in the sense that, just don't get a vaccine because, you just want to do it without asking questions. Ask your doctor, what is my time? What's in the vaccine? Am I going to be allergic to it? What are the side effects? I think being a proponent and advocate for yourself is always good.
Yes. Well, thank you so much for your time, Dr. Raj. We appreciate it, and we will talk to you soon.
Anytime. Okay, bye-bye.